When a woman is suffering through fibroids, for me, one of the most remarkable things is the resilience that women have to just work through the issues, the heavy menstrual periods, the fact that they're waking up multiple times in the middle of the night and not getting restful sleep, and now having to go to work, having to be mothers, having to be managers, having to basically show up in their personal lives and their professional lives with all of these things that the fibroids are basically exacerbating and not allowing them to produce, but they are just gritting through it. First of all, I think one of the most difficult things when somebody has an experience with a physician is they feel that it's a very clinical experience. Their disease was treated, but they were not treated. They were managed, but they weren't sort of supported. Okay, and so for us, we're all humans, right? We all want to feel like someone who's cared for. So at the first level, our goal is to make people feel like humans, basically living with issues that we all suffer with, that we can relate to. In the case of women, this is not just an issue that we all can relate to because we can't. We're not women. So this affects women in a very unique way. The second thing when it comes to women is when being a God-fearing man, one of the most important sort of admonitions in the Bible is to be fruitful and multiply. How can we do that without our women, without our queens? Okay, what do fibroids do? They attack women at the core, where they are often not able to be fruitful and multiply. And here's why. When it comes to the fibroids, what is one of the main issues that women complain of with fibroids is pain on intercourse. I have so many patients that come into my office and say, you know what, intercourse used to be so pleasurable, but now it's not. It's painful. It's distressing. I feel like I'm doing it and it's like a chore, but it's so painful. I've had women in my office who've had divorces because they went from being intimate and enjoying it and asking for it to now getting to the point where they find it repulsive because it's so painful. They're basically just tensing up to the point where now they don't even want to do it, and their partners are just so surprised of just how stark the transition was from enjoying intercourse to being fearful of it. Okay, and then you have a group of women who just are infertile because of the fact that the fibroids are present, which we know that in 5% of women, the fibroids are the sole cause of infertility, right? The other piece is that when women do get pregnant, we know that up to 40% of those women will have pregnancy complications, ranging from preterm labor to abruption of the placenta to miscarriages, where the baby ceases to be a baby. And the mothers-to-be are not mothers-to-be because they've lost their pregnancy, okay? So when it comes to honoring femininity, it basically takes me knowing how does it affect women. It affects them in their ability to procreate, to have intercourse and enjoy it. It affects them in their ability to have a safe pregnancy that is fruitful, that brings them from pregnancy to delivery in a very safe way. But finally, the piece of femininity comes from the point that if you think about the alternative to treating fibroids, what is it? Suffering through it, right? Having the little lumps and bumps on the abdomen, you think that makes women feel as if they look pretty, that they look like they are at their best? No, absolutely not. There are women who come into my office and they show me, where the little bumps are that they know are just people are probably looking at. They try to poof their blouse out so that they can cover it up. They try to do sit-ups in such a way where it sort of tries to compensate for these little lumps and bumps, and it doesn't help. And so in their mind, they know that they see disfigurement. They know that they have a compromised body image because of their fibroids, but they can't do anything about it. So that doesn't make them feel pretty, which doesn't make them feel as if they want to be in a position where they want to be intimate, because they feel like their body's being looked at in the same way that they look at their body and feel like they just need to get rid of this thing inside them, okay? But then the other piece of it is what? If these women surrender to a hysterectomy, what's going to happen? They're going to no longer have what? The ability to procreate, to be fruitful and multiply, the ability to bring life into this world, which as a mother, as a queen, is part of their purpose, right? And so they are now having to part with their uterus as a means of treating their fibroids, which is hogwash, okay? And what's the other alternative? It's a myomectomy. And in the case of the open myomectomy, which many women sort of require, or even in the case of the robotic or the laparoscopic, the difference is a big incision or multiple tiny ones, which are still incisions that will leave you with scars. Scars that when you wake up in the morning, when you come out of the shower, when you go into the shower, when you're drying off in front of the mirror, these women are looking at their scars. Do you think those scars make the women feel prettier or less pretty? The women that I certainly have seen that come into my office, some women who've had 2 or even 3 myomectomies prior to coming here because their fibroids have basically been treated and then the symptoms recurred 2 to 3 years later. Symptoms removed, treated. After treatment, they're fine. And then 2 to 3 years later now with another surgery, another incision, okay? Now, these women are now looking at this and saying, you know what? I don't really like the way my body looks because I have this big old scar, but they know they chose to do it because it was something that was necessary at the time. So when it comes to us honoring their femininity, what does that mean? We're recognizing that what? These women need to feel as if you know where it hits them in their unique role as women, okay? And what is that? Their energy, okay? The fact that this zaps their energy level and doesn't allow them to be best resilient selves, showing up day to day in their personal and professional lives. And in many cases, what? When the fibroids are touching the ovaries and the surgeon makes a game time decision and has to not only take out the uterus but the ovaries, what is now happening? Menopause is on its way. And so in some cases, many women go into menopause post-hysterectomy because the ovaries may have had to be removed in that process. And then finally, the fourth thing is what? The scars on their body. When women surrender to these invasive surgeries like a hysterectomy or myomectomy because they were told by people, doctors that they trust, that those were the only options. And what we know, which you know, because we're having this conversation, is because you know me as a fibroids expert and interventional radiologist is committed to educating you and supporting your sense of awareness, is that the uterine fibroid embolization is probably one of the least known medical procedures that stands to completely transform a woman's life from one that is completely lifestyle limited and distressing with a condition like fibroids to being one where the fibroids and their symptoms are non-existent and they are basically reconnecting with the sense of peace of mind that they absolutely deserve. So if you ask me, what does honoring the femininity of women look like? It looks like that. And this is why at the Bahamas Fibroid Intervention Clinic, in my community of women that I see in consultation, post-treatment, I call you what you are, which are queens. You are queens, and you should be treated as such. I'm Dr. Mikhail Higgins, fibroids expert and interventional radiologist. I'm so grateful for you. Our job, our commitment is to honor you. We so appreciate the opportunity to keep the conversation going. Talk soon.